Hello, I'm David Webb, the Secretary of AMAF Federation, here to deliver a public service announcement regarding the current situation with the COVID-19 pandemic here in Victoria. The Victorian Multicultural Commission has asked community organisations like us engage with their community members, particularly people who are of culturally and linguistically diverse backgrounds, in order to ensure that all Victorians are able to understand the situation and the measures that are being put in place as a response. Recently, Victoria has had an easing of restrictions. You are able to leave your home. You're able to gather, but have no more than 5 guests at any house. And if you gather outside of your house, then gatherings of no more than 10 people are allowed. If you go to one of the restaurants or cafes that have now opened, then you'll notice that they are only allowed to open every second table and that they have an overall limit on the number of people who are allowed to be in there. There is also a policy that they will need to keep a logbook of the people who attend the eating establishment, whether that be a cafe or a restaurant. Since the easing of restrictions, there has been a spike in numbers of COVID-19 cases. This has led to a concern on the part of healthcare professionals and politicians that there may be a second wave of infections. It's essential that we prevent this to ensure that deaths are minimised and that health services are not overwhelmed. There have been a number of hotspots identified here in Victoria, in Melbourne and its suburbs. In particular, there are 10 suburbs that have had a high number of cases in the recent few days. These suburbs are Keilor Downs, Broadmeadows, Maidstone, Alban Vale, Sunshine West, Hallam, Brunswick West, Fawkner, Reservoir and Pakenham. If you live in one of these suburbs, you're advised not to leave your suburb unless it is absolutely essential. If you do not live in one of these suburbs, do not go to these suburbs to visit people, to shop, or for any other reason unless it is absolutely essential. There is currently a blitz in progress which involves over 1,000 personnel, including over 300 Australian Defence Force personnel who are visiting homes, door knocking in these areas, and also setting up mobile testing centres. If you live in one of these suburbs and a person in a uniform knocks on your door and asks to test you for COVID-19, then you need to understand that testing is as a precaution. It does not mean you have the infection, and it is free of charge regardless of whether you're covered by Medicare or health insurance. Based on the state government health department's advice, if you are feeling sick or have symptoms that it might be similar to COVID-19, you should firstly self-isolate and secondly get tested, preferably at a drive-through testing centre. If you believe you've been in contact with other people, or if you live in one of the at-risk suburbs, also, you should be getting tested. And you must self-isolate while you wait for your test results, regardless of whether you have symptoms or not. The testing centres will give you a medical certificate in case you have work and other commitments during that time. Regardless of where you live, it's essential that you continue to observe all of the regular precautions, including practicing good hand hygiene, social distancing, especially in public spaces, and working from home if you're able to do so. In the links below, you'll find a previous video that we've done regarding hand hygiene and a variety of other information. I thank you very much for your attention, and please stay safe as a community.